The strange city of Seoul. 513 confirmed cases of COVID-19 and 0 deaths. As of April 3rd, there have been no deaths due to COVID-19 in Seoul, a city boasting a population of 10 million. As of March 31st, over 3,400 people have died in the U.S., with the majority of deaths occurring in New York. There have been 11,591 deaths in Italy and 8,269 in Spain, with a staggering total of 40,000 deaths worldwide. Let's take a look at the current status of deaths in major cities worldwide. First, as of March 31st, New York, USA has confirmed the death of 1,342 individuals. Rome, Italy has confirmed the death of 185 individuals as of April 2nd, and Madrid, Spain has confirmed the death of about 3,865 individuals as of April 1st. Berlin, Germany has confirmed the death of 9 individuals as of March 26th, and Beijing, China has confirmed the death of 8 individuals as of March 23rd. Paris, France has confirmed the death of 180 individuals as of March 27th. London, England has confirmed the death of 729 individuals as of April 2nd. Tokyo, Japan has confirmed the death of 16 individuals as of April 2nd, and Stockholm, Sweden has confirmed the death of 178 individuals as of April 2nd. 0 deaths. How did something so miraculous happen? The following contents do not aim to simply publicize the city of Seoul. This is an objective introduction of facts and expertise as noted by the world. First, major cities around the world are turning their attention to Seoul. The video conference on March 27th, which saw the attendance of the mayors of 45 major cities around the world, was a clear demonstration of the current situation. At this conference, arranged after an urgent proposal by Mayor Eric Garcetti of Los Angeles, participants showed great interest in Seoul's quarantine know-how and experience. Seoul was noted for its innovative actions, including the prompt diagnosis system and the separated treatment facilities for seriously ill patients. The city of Seoul maintained its urban functions without the enforcement of a lockdown and prevented the risk of infection through the release of confirmed patients' paths of movement and transparent policies, all which were made possible through the mature and democratic spirit of the citizens. The quarantine know-how and expertise of Seoul and Mayor Park Won-soon, which were acquired through the MERS outbreak, demonstrated its power during the COVID-19 crisis. At the first conference headed by the Prime Minister on January 24th, in the early stages of the situation, Mayor Park Won-soon proposed that the standard range of symptoms be increased due to the severity of the spread of COVID-19. The globally recognized countermeasures that South Korea took against the aggressive infectious disease began at that very meeting. Mayor Park Won-soon proposed that coughing and phlegm be included in the symptoms for the disease on top of fever, cough, and respiratory symptoms. On this day, Mayor Park asserted that the region for mandatory self-isolation of individuals be extended from those coming from Wuhan to those coming from the entire area of Hubei. Although it may sound obvious in the present time, there was hesitancy in enforcing such intense quarantine measures at the time. Fortunately, the government accepted both proposals and the battle with COVID-19 officially began. With a sudden increase in the number of confirmed cases in the early stages of the virus, the government-operated hotline 1339 was flooded with phone calls. To be confirmed, patients and the public were confused upon learning that one should not visit a medical institution when experiencing symptoms. Seoul began the COVID-19 consultation service through the 120 Dasan call center. The usual thousands of phone calls increased to 10,000 at the Dasan call center during the confusion, but the overall situation eventually gained stability. Not everything went smoothly for the government and Seoul. On January 31st, Mayor Park Won-soon, who continually spoke favorably towards the government measures taken against the disease, harshly reproached the KCDC. Mayor Park criticized the dawdled announcement of confirmed patient information and its failure to promptly share the list of foreigners entering from Wuhan with autonomous districts. After that day, the announcement of confirmed cases by the KCDC was increased from once a day to twice a day. The lists of foreigners with a risk of spreading infections were delivered to autonomous districts nationwide. Postponement of the start of the school year at the universities with large international student populations. and a ban on large-scale gatherings in the city were also proposed as crucial quarantine countermeasures during this situation. Yet the most important step taken was the declaration to take a break. On March 2nd, Seoul proposed taking a break for 2 weeks as part of social distancing. This was 10 days before the WHO declared the COVID-19 outbreak a pandemic. The city expected criticism from citizens as they would experience inconveniences. Yet, Seoul endured the inconveniences and pushed forward with the campaign to speed up recovery. Seoul's action took some weight off the government's shoulders. Social distancing then spread to all parts of Korea. Seoul's struggle to stop the spread of COVID-19 was evident in the city's resolute measures. On March 21st, an order for a complete ban on large-scale gatherings in the city was enforced. Despite warnings, Mayor Park Won-soon personally visited sites of weekend gatherings and voiced that if Seoul was exposed to the virus, all of Korea would be exposed to it as well. He also took the lead in taking action against the Shincheonji Church. The Shincheonji Church hindered disinfection and failed to cooperate with investigations, in addition to inflicting immense social harm on the public. On March 27th, the city took intense measures and revoked permissions for corporate activity by Shincheonji, performed a tax investigation, demanded payment of previous tax reductions, and charged the Shincheonji Church for compensation for all disinfection costs caused by the church. The administration of Seoul, that finds truths based on facts, also proved successful with the emergency loans for small businesses. As the number of small businesses suffering from COVID-19 increased, the number of applications for loans piled up by tens of thousands. A situation occurred in which businesses would receive loans starting in summer due to the document process, despite the urgent need for funds. Seoul took measures into its own hands. Bank branches in the city began to take part in reviewing documents and receipts for loans. About 300 personnel were added to appropriately complete the reviews. Mayor Park Won-soon declared that the 2-month loan process would be completed within 10 days. The business circle commented that a loan process completed in 10 days would be as epochal as successful disinfections. It can also be concluded that the government's Emergency Disaster Support Fund was modeled after Seoul's actions. Aside from the range of receipts and the sum, the government's basic plan was nearly identical to Seoul's proposal. In the midst of the rising conflict between the ruling and opposing parties regarding the implementation of the basic disaster allowance just before the upcoming general elections, the proposal by Seoul reached a breakthrough. Governor Kim Kyung-soo of Gyeongnam proposed early on that 1 million Korean won in basic disaster allowance be given to all citizens, which was an adaptation of Seoul's original proposal. The front line of COVID-19 faced an ambush. The number of confirmed cases in Seoul fell below 10 once. However, residents abroad and international students began to enter Korea in masses under the impression that Korea was safer than staying abroad. The average number of individuals entering the country from abroad daily reached 1,600, and the country faced its biggest crisis. Mayor Park Won-soon revealed plans to perform diagnostic testing on all entrants from abroad who reside in Seoul starting April 3rd. The screening center for entrants from abroad in the parking lot of the sports complex was the largest facility of its kind in the nation. 25 tents and 9 containers were installed. About 100 medical professionals were placed on site, and testing of up to 1,000 individuals was made possible. The screening center could meet the demands for testing thanks to the walk-through method that completed testing of each individual in under 5 minutes. Mayor Park Won-soon responded to the viewpoint that Seoul was at the center of the quarantine measures taken by Korea.
Our experience with MERS helped immensely in facing the COVID-19 crisis. Unlike past administrations, the Moon Jae-in administration accepted Seoul's proposals when considered reasonable. These proposals, made several times, were not accepted by past administrations. Seoul and the government together created the model for quarantine in Korea. I feel great pride in knowing that the world is scrambling to learn about our expertise and know-how.
The first Army commander of the front line of the COVID-19 battle in the U.S. is Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. Due to his expertise and convictions, he gained a good reputation in New York, so much so that his face was put on donuts. Director Fauci stated in an interview that in order for science to face the White House, one must repeat facts 2, 3, 4 times, and that he would continue to push. Trump's actions against COVID-19 were passive, and his failure to take early measures resulted in the present catastrophe. South Korea gained attention of the international society in the battle with COVID-19, and at the scene of the sharp increase was exemplary and communicative leadership.
1,000 people, but we are not anywhere close to that. How did South Korea test so many people so quickly? Why did it take so long?
They're testing 10,000 a day in some countries, and we can't get this off the ground. The modeling we're using data out of Korea. We think that's the best
And what is that?
Similar numbers to Italy and Iran. The death toll here is much lower. At least some success, they think, is because of the vast amount of testing. More than 200,000 people tested in this country already.
South Korea has more diagnosed cases of coronavirus than any other country outside of mainland China. We're going to take a look at an innovative technique.
저는 이 감염병에 있어서 가장 중요한 원칙, 투명한 것. 그리고 신속한 것. 어떤 경우에도 확진자가 생기면 그 확진자의 동선을 재빨리 파악해서 그분들이 자가격리할 수 있도록. 그 어떤 나라보다도 빠르게 확진 검사가 이루어지고 그 정보가 투명하게 공개되고 있는 선진적인 공개 의료 시스템은 세계 모범으로 평가받고 있습니다. 이것이 대한민국의 객관적인 모습이고 위대한 시민의 모습입니다. 코로나19와의 전쟁에서 우리는 이겨가고 있습니다. 우리는 함께 이 고난의 강을 건너고 잃어버린 봄을 반드시 되찾고 말 것입니다. 서울시는 언제나 가장 최전선에 서겠습니다. 서울시의 백신은 변함없이 시민 여러분입니다.
구독과 좋아요 버튼을 눌러주세요.